Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication that you've probably heard of. It's known as aspirin. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Aspirin is a potent inhibitor of prostaglandin synthesis and platelet aggregation. It inactivates cyclooxygenase via acetylation. This prevents the conversion of arachidonic acid to thromboxane A2. Platelet aggregation would then be inhibited for their lifespan of 7 to 10 days. There are many uses for aspirin, so I'll list off some of the indications here for you. Some patients use it for generalized aches and pains. Others use it for fever. Some patients have success using aspirin to treat their headaches and migraines. Patients with chronic coronary artery disease use aspirin prophylactically to prevent themselves from having any cardiovascular events. Some patients use it to treat osteoarthritis. Some patients use aspirin when undergoing a carotid endarterectomy. It's used after a cerebrovascular accident. When patients are undergoing a coronary artery bypass graft, they use aspirin. Some disorders of the joints and spine may be treated with aspirin as an adjunct. It has a place in therapy when treating rheumatoid arthritis. Patients use aspirin when they have chronic but stable angina. It can be used for the treatment as well as the prophylaxis of a transient ischemic attack. And finally, patients with unstable angina may also use aspirin. Now, before somebody was to use aspirin, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. So aspirin would be contraindicated in patients who have a hypersensitivity to aspirin or other non-steroidal anti-inflammatory drugs. Aspirin should not be used in patients who have asthma, rhinitis, or nasal polyps. This is because severe urticaria, angioedema, or bronchospasm may occur. So now in terms of precautions, aspirin is on the Beers criteria, which is a list of medications that the elderly population should try to avoid or use cautiously. In this population, we just want to avoid chronic doses over 325 milligrams. Especially if they're unable to use a gastroprotective agent, such as a proton pump inhibitor. Gastric ulceration as well as bleeding may occur, so it should be avoided in patients who have an active peptic ulcer. There is also a risk of bleeding with this medication. It would be more of a risk if the patient was using other medications that also increase the bleeding risk, such as anticoagulants. We should avoid use of aspirin in patients who have severe hepatic insufficiency. Should also avoid using it in patients who have severe renal failure. There's also a risk of fetal harm when this medication is used in the 3rd trimester of pregnancy, so this should also be avoided. Now once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start using aspirin, they can expect to take it in tablet form. When people are using aspirin for secondary prophylaxis, so they've had a cardiac event and they're trying to prevent another, we would use what we call baby aspirin, or 81 milligram aspirin, 1 tablet once daily, indefinitely. There is a range here in that it can go from 75 to 100 milligrams, but 81 milligrams is the common dose. When treating a fever, 325 milligrams or 650 milligrams 2 to 4 times daily may be appropriate. We just don't want to go over 4 grams in 24 hours. When using aspirin to prevent flushing associated with niacin, 325 or 650 milligrams can be given 30 minutes prior to a niacin dose. For headache, patients can use 500 to 1,000 milligrams every 4 to 6 hours, but keeping in mind that they can't go over 4 grams per day. In pain, 325 or 650 every 4 hours could be appropriate. And in unstable angina, anywhere from 75 to 325 milligrams once daily may be used. Now, as with all medications, there are some adverse reactions or side effects that patients may experience while using aspirin, so I'll list some of those here for you now. Some patients have experienced a gastrointestinal ulcer. Others have experienced a hemorrhage. Exudative, age-related macular degeneration has been reported. Some patients experience tinnitus. Others experience bronchospasm. And finally, angioedema and Ray's syndrome are also possibilities. That's all we're going to talk about today with aspirin. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.